Hello, I'm Dr. Aneesha Joseph, consultant dermatologist and cosmetologist at SH Medical Center. Now, everyone is aware that diabetes affects various organs of the body. But however, it is very surprising to see that majority of the patients who attend the dermatology OPD are unaware that some of the changes which appear on their skin is because of their diabetic status. Now, these changes can indicate that either their blood glucose level is very high, or that they are a pre-diabetic and soon to be diabetic, or that their current treatment needs to be regulated. Now, of the various changes that occur, I would like to speak today about just 3 to 4 conditions that we come across regularly. First and foremost is xerosis or dry skin and itching or pruritus. Now, this xerosis or dry skin occurs when the increased blood glucose level results in poor blood circulation, decreased blood flow to the skin, and this is what results in the various changes that appear in the skin's texture, appearance, as well as its ability to heal. And it is this dry skin which results in the unbearable itching that we see in these diabetic patients. The itching can be so bad that it interferes in their day-to-day activities, it disturbs their sleep, and just affects their general well-being. Now, there are certain things that we can do to minimize this. First and foremost is take short, lukewarm bath. Now, people who have a dry skin, they have a tendency to wet their skin often. Now, this needs to be avoided because it just dries the skin out more. Secondly, we need to avoid rubbing the skin because that again will cause dryness, thickness of the skin, and also cuts and wounds which may be difficult to heal. Thirdly, use fragrance-free soaps and cleansers. And lastly, it is important to moisturize the skin. And this needs to be done immediately after a bath and as and when required. Now, if these do not help, you may also require certain topical medications, certain soothing lotions, as well as antihistamines. Now, another change that is commonly seen is skin tag and acanthosis nigricans. Now, these appear as elevated, raised, or flat, either brown or dark colored lesions, commonly seen in the neck, the axilla, and the face. Now, these are also seen in normal individuals, but in a diabetic patient, there will be an increase in the number of lesions. And this is also seen on a background of what is called as acanthosis nigricans, where the skin appears thick, velvety, and hard. Now, most of the time, this does not require any treatment, but if treatment is required, cauterization is the mode. And lastly, certain fungal and bacterial infections. Now, compared to a normal individual, now these infections may be recurrent, they can be chronic, and they can also be resistant to treatment, and therefore continuous follow-up is required. And so one must always remember that a change in the skin may be the first sign of diabetes, and this should not be ignored, and you must consult your specialist and get an appropriate treatment. Thank you.